From the dawn of human existence, depression has loomed as an invisible predator, stealing light from the brightest minds and shadowing lives with despair. For centuries, it was a phantom, misunderstood, misdiagnosed, or not recognized at all. Now, as science peels back the layers of the human brain, we begin to grasp its staggering complexity, yet the cure remains elusive. Depression isn't a one-size-fits-all affliction. It's a tangled web of neurological mysteries that makes treatment an intricate dance of trial and error. Modern imaging techniques have opened windows into the brain's inner workings, revealing structural changes and disrupted activity linked to depression. However, even with cutting-edge technology, pinpointing the exact cause is like trying to solve a puzzle with missing pieces. At best, researchers form educated guesses. These insights are invaluable. Yes, but they still demand immense resources, time, money, and effort to identify root causes buried deep within the brain's labyrinth. Depression often arises when critical brain systems fail to operate as they should. Neurotransmitter imbalances, for instance, disrupt the chemical messengers responsible for mood regulation. Brain circuits connecting the prefrontal cortex, amygdala, hippocampus, and anterior cingulate cortex, all of which govern mood and emotions, sometimes falter, causing the delicate equilibrium to collapse. Studies have consistently shown reduced brain volume in individuals with depression. Elevated levels of stress hormones like cortisol can impair the hippocampus, shrinking its size and functionality. Meanwhile, the HPA axis, a key system regulating stress responses, can malfunction. When this system fails to recall and shut down cortisol production, the excess hormones wreak havoc on mood regulation, exacerbating the symptoms of depression. These intricacies highlight a painful truth. Most individuals lack access to the technology and expertise needed to pinpoint which system has gone awry. Consequently, treatments often feel like throwing darts in the dark. Medications aim to target specific dysfunctions, but discovering the right drug and dosage is a painstaking process. Each treatment focuses on addressing symptoms rather than curing the underlying cause. This explains why depression frequently returns once medication is stopped. The root problem remains uncorrected. The origins of depression are multifaceted, rooted in a complex interplay of genetic, biological, environmental, and psychological factors. What's even more perplexing is how identical causes can manifest in vastly different ways among individuals. Environmental factors like a turbulent childhood can impair neuronal firing in some, leading to chronic stress responses. For these individuals, therapies like talk therapy may help rewire the brain's neuroplasticity. However, when the trauma runs deeper, more intensive interventions such as movement desensitization and reprocessing or medication may become necessary. Genetic predisposition adds another layer of complexity. Inherited traits can make some individuals more susceptible to depression, rendering talk therapy ineffective. Here, medication often becomes the sole avenue for relief. On the biological front, inflammation, not just in the brain, but originating from the gut, can play a significant role. In such cases, dietary changes might yield more noticeable results than traditional therapies. The frustrating reality is that depression's multifaceted nature makes it a relentless adversary, particularly for those without access to medical care. Treatments often span months, sometimes years, as individuals cycle through different therapies in search of one that works. For those facing the most severe cases, interventions like deep brain stimulation are emerging as a beacon of hope. Originally developed to treat movement disorders like Parkinson's disease, DBS involves implanting electrodes in specific brain regions to deliver controlled electrical impulses. In the context of depression, DBS targets the subgenual cingulate gyrus, a region shown to be hyperactive in individuals with the condition. This area plays a pivotal role in mood regulation, making it a prime focus for intervention. The procedure is intricate. Thin electrodes are carefully placed in the targeted brain region and connected to a pulse generator implanted under the skin near the collarbone. These electrical impulses influence neural activity by modulating action potentials, the electrical signals neurons use to communicate. Depending on the frequency and intensity, these impulses can activate, inhibit, or modulate neural activity, restoring balance to disrupted neural networks. While DBS holds immense promise, it's not without risks. As an invasive procedure, it carries potential complications and remains experimental, accessible to only a few. The scientific community agrees that more research is essential before this therapy can become widely available. Still, the progress made in understanding its mechanisms reflects how far we've come from the crude shock therapies of the past. Today, DBS is guided by a deeper understanding of brain function and bolstered by advanced technology, offering a glimmer of hope for those battling treatment-resistant depression. What these advancements underscore is the sheer gravity of depression. For some, lifestyle changes like exercise or gratitude practices might alleviate symptoms, but for others, these approaches are woefully insufficient. The stigma surrounding mental health treatments, especially medication, must be dismantled. If society doesn't bat an eye at medication for heart conditions, why should mental health be any different? The brain, after all, is just another organ, albeit an extraordinarily complex one. The fight against depression is far from over, but every discovery, every breakthrough, brings us closer to understanding its intricacies. And with that understanding comes the possibility of relief, hope, and maybe one day a cure. In the meantime, let's continue to advocate for compassion, access to care, and a world where seeking help is seen as a strength, not a weakness.